Hello everyone. Today we will discuss about the steps for evaluation of the fixed dose combinations and what are the rational and irrational FDC and how you can evaluate the rational or irrational FDC which is given to you in the exam or in the NEET PG exam. So let us discuss about the steps for evaluation of FDC preparation. So first you have to check the therapeutic aim and whether the patient requires long or short term treatment for the FDC. Second, you have to check the ingredients and their doses. Check whether any of the ingredients are unnecessary to the patient and you are prescribing it in the form of the FDC or not. Third is you have to evaluate whether the combination is approved, rational, desirable and it should be prescribed to this patient or not. Fourth, whether the patient is in a mild to moderate form of the disease, stable and least likely to develop any emergency situation when you are prescribing FDC to the patient. Fifth is check the requirement of the patient and whether the patient needs all the drugs which are present in the formulation or not, that you have to check. Sixth is find out the potential advantage of combining the ingredients in the terms of pharmacokinetic, pharmacodynamic or in terms of therapeutic advantage, convenience or cost. Any of this advantage is present, then you can prescribe that FDC to the patient. So these are the steps for evaluation of a FDC preparation. Now let us discuss some of the FDC example and whether they are rational or not. So first is tablet amlodipine LS, amlodipine and losartan which is prescribed for hypertension. Now here amlodipine is a calcium channel blocker and losartan is a angiotensin receptor blocker. It is having complementary mechanism and this provides excellent blood pressure control. Angiotensin receptor blocker decreases CCB-induced pedal edema and it also improves patient compliance because the patient has to take only one drug instead of the two drugs which is separately prescribed to the patient. So this makes this combination rational FDC. Another very commonly prescribed is metformin plus sitagliptin, which is a DPP-4 inhibitor, which is prescribed for diabetes. Sitagliptin is a DPP-4 inhibitor which increases the incretin hormones and enhances glucose-dependent insulin secretion and lowers the risk of hypoglycemia. So this combination is a rational FDC. Another combination is metformin plus glimepiride. Metformin decreases the hepatic glucose production, improves the insulin sensitivity. Glimepiride increases insulin secretion. These two different mechanisms provides better glycemic control even in the lower doses. So here it is a synergistic action. So this combination is again rational FDC. Now another is ipratropium plus salbutamol. Ipratropium is a anticholinergic agent. Salbutamol is a short-acting beta-2 agonist. These two drugs are given in the treatment of the COPD and this provides greater bronchodilation than either of these drugs alone. And this combination is preferred in COPD exacerbation situation. So this makes this combination rational FDC. Rifampicin plus isoniazid plus pyrazinamide plus ethambutol. This combination is given in the treatment of tuberculosis. Now instead of 4 tablets, patient has to take only single tablet and that will simplify the treatment to the patient which is given for long term. So when you are combining all these drugs in a single formulation, it will also improve adherence of the patient. These drugs also decreases the emergence of resistance. So this makes this combination rational FDC. Amtricitabine plus tenofovir, these two drugs is having different mechanism and it also prevents viral resistance. This also provides better adherence and lowers the pill burden. Stavudine plus lamivudine plus nevirapine. These drugs are also having different mechanism which prevents the viral resistance, better adherence and lower pill burden. So this HIV treatment combinations are also rational FDC. So clavulanic acid, which is a beta lactamase covering enzyme inhibitor, amoxicillin, which is often combined with the clavulanic acid. Clavulanic acid will increase the antimicrobial spectrum by covering the beta lactamase producing organism. So this makes this combination rational FDC. Artemether plus lumefantrine, sulfadoxine plus pyrimethamine. These are also preferred in the treatment of the malaria, and this combination is also rational as it decreases the chances of the resistance and also provides better control of the malaria. And this is also rational FDC. Ethinyl estradiol plus levonorgestrel. These two drugs are having different mechanism as well as they decreases the adverse effects of the ethinyl estradiol. So this combination is a rational FDC. Lignocaine plus adrenaline. So adrenaline will increase the availability of the lignocaine at the local site where you want to give the local anesthesia. It also decreases the systemic absorption of the lignocaine. So the peripheral side effect of lignocaine will be minimized and adrenaline will provide powerful vasoconstriction. So that is the advantage of this to combine it with the lignocaine and that makes it rational FDC. Levodopa plus carbidopa. This is also rational FDC which is used in the treatment of the Parkinsonism. Carbidopa is a peripheral decarboxylase enzyme inhibitor and that is how it will increase the availability of the levodopa inside the brain and so levodopa will be converted in the brain to dopamine and that will provide better control of the Parkinson's disease. As well as carbidopa, as it increases the availability of the levodopa inside the brain, it also decreases the dose requirement of the levodopa and also decreases the peripheral side effects of the levodopa. For example, nausea, vomiting, cardiac arrhythmia, orthostatic hypotension, all these side effects of levodopa are minimized. So these all drugs we have discussed so far, these are the rational FDC example. Now let us discuss some of the irrational FDC example. So in the market you will be able to find many of the cough syrup formulation which may contain 2 or 4 or more than that ingredients. These all cough syrup formulations are irrational. Some of the multivitamins where you will be able to find so many content, these all are also irrational FDC example. So irrational FDC example include two NSAIDs together, no increase in the efficacy. Instead of it, it can increase the risk of adverse effect, for example, gastritis or GI bleeding. Nimesulide when given along with the paracetamol, it is having no proven additional analgesic benefit. Instead of this, it also increases the risk of hepatotoxicity. So this FDC is a irrational FDC. Now another example is amoxicillin plus cloxacillin. These two drugs are having overlapping spectrum, fixed ratio which is not appropriate for most of the infections and it can also promote unnecessary antibiotic exposure. So this FDC is also irrational FDC. Now syrup glycodine, terpene hydrate, dextromethorphan, menthol, tolu, Vasaka liquid extract, glycerin. These all ingredients which are present in a syrup which are prescribed for the non-productive cough. So all these are not needed for dry cough or non-productive cough. For non-productive cough, only dextromethorphan, which is an antitussive, that is enough, and all these agents are not needed. So there is a little additional benefit, and all these agents can increase the chance of the adverse drug reactions. So these agents should not be combined in a syrup. Menthol and glycerin are the cooling agent. Vasaka is an expectorant. Tolu is also expectorant. All these agents are not needed for the non-productive cough. So this combination is a irrational FDC. So these are some of the irrational FDC example. Now let us discuss how to evaluate any FDC. So you have to evaluate any FDC in a smart way, and the mnemonic for this is a SMART. So S stands for same therapeutic objective. Do all drugs treat the same disease or same symptom? For example, amoxicillin plus clavulanic acid. Clavulanic acid increases the antimicrobial spectrum. So yes, then it is a rational FDC. Dextromethorphan plus expectorant. So these two drugs are not needed for the treatment of the same disease. For example, for dry cough, dextromethorphan is enough. So expectorant is not needed. So this is a irrational FDC. Next is whether the mechanisms are complementary or not. Do they work by different mechanisms? For example, levodopa plus carbidopa. If yes, then it is a rational FDC. 2 NSAID, they act with the same mechanism. So this is irrational FDC. Now A stands whether the advantage is proven or not in terms of better efficacy, less toxicity, better compliance, prevention of the resistance. If no added benefit, then it is a irrational FDC. R stands for whether the risk is acceptable or not. Does the combination increases the adverse drug reaction, drug interactions or polypharmacy? If the risk outweighs the benefit, then it is likely to be irrational FDC. And T stands for whether the titration is possible or not. If one drug needs dose adjustment, then that is the major limitation, and in that case, you will not choose FDC. So the mnemonic to evaluate any FDC, that is SMART, and that we have discussed. Now coming to the high yield exam tip. For the same disease, if you are giving the two drugs which are acting with the different mechanism, and if it provides better outcome and less harm to the patient, then it is likely to be rational FDC. And if the drug is not having any of this advantage, then it is likely to be irrational FDC. So in today's video, we have discussed about the steps to evaluate the FDC, what are the common viva questions, that also we have discussed, and the rational FDC and irrational FDC, and this can be asked in the viva also. If you like this video of pharmacology, then subscribe my channel and follow for more such pharmacology related videos. Thank you.